Hey guys, so I am at Gordon's place right now. We're about to run and get something to eat, which I'm going to relish in because this is the last week that I'll probably be able to eat amazing solid foods for a long time. I told you guys on Instagram that I am getting a tonsillectomy and a procedure done for my deviated septum this week. I'm so excited about it. I told the whole story on Instagram and I've chronicled all the times when I've had tonsillitis or strep throat, but basically since I was like 4 or 5 years old, I'm 26 now, I have gotten strep at least 3 to 5 times a year without question. Anytime I'm on a plane or more than one plane in a 24-hour or 48-hour time frame, I get sick. And it's crazy because I have so many friends who have never had strep before in their lives. They never get tonsillitis, like they've never had a sore throat, nothing. And I am always the one who missed out on field trips, who missed out on important meetings, has to stay out of school for 7 days because of it. And it's just taken over my life in a way that is just becoming not okay, especially as an adult. You can't just take 7 days off of work and people are like, oh yeah, no problem, you have a sore throat. Like, no, actually my tonsils feel like they're touching each other. They look like they're touching each other, and it is so painful that I can't speak or breathe or, live and function like a normal human being. So needless to say, I'm very excited to get these suckers out. I don't know if you can see it right now. Oh, you see that one on that side? My right tonsil is always more enlarged than my left one. See that shit? And that's like on a regular day. My throat isn't sore, nothing. When my throat is sore, they're literally touching. It's disgusting and crazy. Today is Saturday. Next Friday, I will be getting the surgery, and next Saturday, the same time, I will be in recovery mode. I'm over the moon because I found an amazing ENT, Dr. Sagari, who's going to be doing my surgery, and he's known for a tonsil welding procedure, which is less painful than traditional tonsillectomies. Stop! I'm doing something. I'll be right back. Just give me 2 minutes. No, I don't need you to see. Go. I can see you creeping in the bushes. Get out of here. So anyway, I'm thankful that he's going to be the one doing my surgery. I've also talked about the fact that since I turned 26, I'm obviously off my parents' insurance, which fucking sucks. I have Kaiser Permanente. They are not covering the procedure, so I'm literally paying out of pocket, full disclosure, $15K for this tonsillectomy plus the deviated septum procedure, which by the way is not going to affect the outside of my nose at all. There's not supposed to be any difference with my actual nose. I'm not getting a nose job, although I wish that this little bump, which I think is the cause of my deviated septum, would go away. It's not gonna happen. We're not doing that. Just because we're living in LA doesn't mean we're getting our whole faces done. Yeah, so obviously the doctor is really, really good. That's the only reason why I'd be willing to pay that much money to have him do this procedure for me. But I think that it's worth it, especially with something like ENT surgery. It's important to go with the best doctor possible for this kind of thing. So what he says that I'll notice, especially with the deviated septum, is a clearer voice, because apparently I'm a little nasally. I had no idea. And just overall, like, better health benefits, especially with my throat moving forward. I've already done my pre-op with a primary care physician to make sure that I'm set for surgery and I'm cleared. On Monday, I have my actual pre-op with Dr. Sagari. Super excited, decided to chronicle it because so many people on Instagram were saying that they too have had these issues and they are looking for some kind of relief and want to know that they're not going to be like dead for 3 weeks if they go about this procedure as an adult, because apparently as a child it's way easier. Yeah, hopefully that covers everything. Gordon is ready to go. Is that a peace sign or are you flicking me off?
Peace sign.
Oh, I couldn't tell. So yes, gonna go eat some good solid food because I will be eating applesauce and jello probably for the rest of the week. We'll keep you guys posted on everything that happens. We are fully blogging all of this, recovery and all. If you are squeamish in any kind of way, perhaps you don't want to proceed forward in this video. If not, let's get these tonsils out. So this is Dr. Sagari. What did you say about my post-surgery?
So after procedure, you're gonna have pain. It's not totally painless. You're gonna have pain, and it's gonna be enough that you'll have to take some either Tylenol or ibuprofen.
Yeah.
And then if that's not enough, Tylenol with codeine. The difference between doing it this way and the other ways is that instead of having 3 weeks of hell, it's usually about a week. So it's a big difference for most people. And there's 3 categories of people. I have some patients that actually don't have any pain. Some people have pain for the weekend. On average, it's 4 to 5 days of needing to take the pain medication. And I only give Tylenol with codeine. It's usually the lowest opioid you can take, and that's usually all you need. It's rare that I have to take anything stronger than that or give anything stronger. Some patients wind up just coming off the Tylenol with codeine on their own and just take Tylenol, and you can add ibuprofen to it. You can have anything you want that's soft. If you just stay on a liquid diet, you'll get bored really quickly.
Yeah.
So
I can't
anything
do that.
soft. You can have sushi, you can have rice, beans, soft meat, you can have chicken that's soft.
Nice.
Chicken. Yeah, you can have anything as long as it's not sharp or spicy.
Do you recommend not doing dairy?
Dairy will make more mucus in the back of your throat.
Okay, so no.
No. The other procedure we do inside your nose, you're not going to have much pain for that. The only thing you'll have from that is some congestion.
Okay. Because my friend said her nose was bleeding all the time, and she had it was painful. She said she felt like she got socked in the face.
So that's not common for the way I do it. You won't have any splints or you have maybe some sutures, but nothing that's going to be really packed in there.
Yeah.
So if there's any soreness, it's usually just that day.
Okay.
Your nose will ooze blood for about a day and a half, and you'll have a little bandage right here. But as soon as it's dry, you can take it off. Most people won't be able to tell you had anything done the next day, other than that bandage if it's still on. You won't be bruised. You won't be swollen on the outside.
Yeah.
You'll just be congested for 4 or 5 days. But most of the patients who have had both these procedures together, it's rare that they complain about their nose at all because they're taking the pain medication for the tonsils.
Right.
And when I do the nose procedure by itself, they usually don't take the pain medication more than a day.
When I told people I was getting the septoplasty, they were like, so is it going to change the outside of your nose? Like, are you going to get a nose job?
So some people need that to adequately address the septum. And some people kind of like, well, while you're in there, you want to do a little bit more.
Yeah.
But in general, I'd say over 95% of the septoplasties that are done probably don't need to change the outside of the nose. So it all kind of depends on what the patient needs or wants. But in your case, you don't have to worry about how your nose is going to look exactly the way it looks now. Most of my patients, it's all about the breathing.
Yeah.
And that'll make a big difference. You'll notice more air through your nose within a week, but you will be congested. But within a week, you're like, oh, I'm breathing better through my nose.
Yeah.
You will be stuffy for several weeks. There's actually a difference between congestion, blocked nasal passage, and stuffy. But what you'll notice is that you will feel more air going through your nose, but you'll feel like you need to blow your nose. And you'll blow your nose, but nothing will come out because it's just still stuffy because I was manipulating the nasal passage. So it'll take some time for that to go away. That usually takes several weeks.
And can you just explain the difference between like a regular tonsillectomy that hurts for 500 years and this one?
Yeah. So there's a million ways to take the tonsil out, and it all depends on how the energy that it applied to remove the tissue from the throat. So your tonsil is like a ball of tissue and the muscle that's left behind. So any way you do it, it's going to leave some damage to the muscle that's left behind, and that's what usually causes the pain.
Yeah.
So the less amount of damage or energy that's applied to the muscle that's left behind, there's less healing that needs to happen, so there's going to be less pain. The instrument that we use, it's actually been around since 2005. It's been around for a long time. Been using it since 2006. And the difference between this instrument and the other ways of doing it, there's multiple different energy techniques to remove your tonsils, is that very little of the energy that is that the instrument produces is actually applies to the muscle. It's all in between the instrument. So they actually measure the energy and the heat energy that is away from the instrument. It's less than 0.25 millimeters. You can actually turn it on and put one end of it on your skin, and it won't burn your skin. It's all in between the two twines of the instrument. And it's heat energy, it's not electrical energy, so it won't spread out. And it's not ultrasound energy or any other type. It's just heat, actually. Yeah. And it works really well. And for 99% of the cases, that's all you need, and it works great.
So it's more gentle on the muscle.
It literally just peels away. And it actually worked great on kids. When I used to treat a lot of kids, it was the best way to do it on kids. It just they didn't have to worry about taking pain medication afterwards.
I had a lot of people in my comments saying, when I said I was going to do this surgery, they said that, you know, they felt like they should have gotten their tonsils taken out when they were like 4 or 5. That's how I feel. And now that they're older and they're, you know, in their 20s, they're going to the doctors, and the doctors are like, we can't do it. It's too late.
Yeah, well, I don't know about it's being too late. I don't think it's ever too late. If you absolutely need your tonsils out, you need your tonsils out. Some people have cancer in their tonsils. You can't tell them that it's too late to take the tonsil out. So, no, if you continue to have recurrent infections, it causes significant issues with your quality of life. If you're winding up in the urgent care, you know, 4 or 5 times a year, and you're taking antibiotics and the risk of strep, it's reasonable to take the tonsils out. It's not unreasonable. The difference is what you're going to go through to get them out, right? Is it going to be something that's reasonable? Is it going to be a month of recovery? I think usually most people are more concerned about that. And usually most people who've had a lot of infections are okay with having a week of sore throat, because that's what they have anyway.
Yeah, exactly.
And so, so the only other thing to talk about is the risk of bleeding. Anytime you take the tonsil out, no matter how you do it, there's going to be a risk of bleeding about a week later, 5 to 10 days later. That risk, I've noticed just in my practice and doing over 1,000 of these, is that it's a lot less than normal. So average accepted risk is 4%. Some people say it's even less, maybe 1% or 2%. I think it's 10 times less that with mine, where people, I mean, and I'm talking about the people that had to go to the ER for their bleeding. Yeah. They all call me. And I know it's only been like 5 over the last many years. Yeah. So I'll take that risk. Right. So, but some people do bleed a little bit, and it bleeds temporarily. So they might be at home and it might bleed a little bit. We'll have them gargle cold water and hydrogen peroxide. As long as it stops, I'm not counting those people. Yeah. So you just call me and say it's bleeding. I said, okay, gargle some hydrogen peroxide and water. As long as it stops, it goes away. Yeah. They're fine. And I think the reason it stops a lot more with these, or the risk is less, is because so much less damage is to the muscle, that the muscle can contract a little bit to contract the blood vessel, and it stops. I am traveling the week of July 1st. So that's plenty of time. I'm just concerned because it's a long flight. I've had people fly over overseas to China after 12 days, so you're more than 12 days. Yeah. Usually after 3 weeks, the risk of bleeding is 0. Directly after the surgery, I should be able to talk and walk and. Yeah. Most people can talk. I haven't had anybody not be able to talk. I don't remember any of my patients having to be admitted for IV hydration, which is a sign that the pain is less, because they are able to swallow. You will have pain though. To you, it'll be like, oh, this still hurts. Yeah. If you're one of those people that did like great on the weekend recovery, you'll be like, you know, I've had patients like do gardening to the weekend and they're fine. So everyone's a little different, but you can just assume you're somewhere in the middle, 4 or 5 days. I've had people another subset of patients went the full week, like 7 to 8 days, and they're like, oh yeah, I had to take the medication through the following weekend. But it's rare that I've had anybody take more than that. The back of your throat will turn, it's pink right now. When you remove the tissue, there'll be a white fibrinous exudate. That's not a scab. That's just the normal healing process. Sometimes that exudate, which is like a film, is irritating to the back of the throat. So there's a couple general ways to clean it. One, hydrogen peroxide and water, 50-50, gargle with that twice a day. Another way you can consider it's actually pretty nice is taking organic honey. A spoonful of that, it'll stick to it and just kind of clean and bring it down. And some people say it has some health properties to it. So those are the 2 things I think you can try that are worthwhile. But it will turn white. That's not an infection. Yeah. That's just like the normal healing process. I've seen pictures of that. Yeah. And all the terrible, horrific tonsillectomy videos. So when you see that, it's usually a black scab, or like an actual scab. So you won't see any of that. You'll just see the white, and then that white will just disappear. When when you're fully healed, when you can't see any white back there. Okay. Which in my patients, it usually starts getting a lot better at the end of the first week. Yeah. Well, I can't wait to never see my tonsils again. Yeah. Feel free to put them in fire if you. We usually send them to the pathologist just to make sure that everything's fine, but they're not going to find anything other than chronic tonsillitis. Yeah, it's there. I'm ready. I've been ready for the past, Good. Yeah, no, this makes a big difference. There's 2 things that is having people breathe better through their nose. It affects their quality of life significantly, how they sleep, how they talk, how they work out. And in fact, people who can't breathe through their nose have an increased risk of having mood disorders because they're just miserable. They're like, they're all the time, every breath. So it makes a big difference in quality of life. And then obviously if you're getting sore throats where it's bothering you, it can make a huge difference. So I'm happy for you. You're going to have a healthier year. Is there anything else?
That's it.
All right.
Thank you.
Great.
So
You're welcome.
much. I'll see you on Friday.
Sounds good.
I'm excited.
How you feeling?